Welcome to Innovating with Scott Amyx. I'm your host, Scott, and today I'm joined by Angie Conley, founder and CEO of Abilitech Medical. Welcome.
Thank you, Scott. Pleased to be here.
So now you spent quite a bit of time at Medtronic in terms of your career, and then most recently part of this at Magic Arms, which was a nonprofit. And I just want to kind of get a better understanding around the context and how your work, especially at Magic Arms, developing, I believe, a 3D printed device to help children use their arms. How did that eventually lead to where you are with Abilitech Medical?
Sure, great, thanks. Well, my background in med device begins with my mission of always having that draw to be able to make the world a better place and be able to help people. So when your discipline gets boring, you're still making a difference. At Medtronic, I was a senior product manager in 6 different cardiovascular product lines. I worked and did some medical device consulting afterwards. And then I was recruited to hire or to commercialize a technology that Magic Arms had, which was a 3D printed exoskeleton made by Sclerosis, a company here in Eden Prairie. And in my tenure there, I was hired 3 days a week. I worked 7. And I fit 12 different patients because it was such a powerful mission. I was drawn to this to commercialize this technology over different, across the United States to be able to make it accessible and affordable. And what I found was the technology, while really transformative, and I saw patients move their arms for the first time ever. And because we were pediatric orphan medical focused, some of those parents just stopped and they looked like they saw a ghost and wept. And it was really an incredibly moving story. However, after about a week or 2 weeks, these patients didn't use the device. And so I brought in some experts, John Zencraft, who formerly led Guidance R&D. And together we kind of assessed this technology to see if it was something that we could reiterate and make it improve so that people would end up using it. And in the meantime, my emails and voicemails were filled with questions like, can you help my sister, my mother, my brother with MS, ALS, spinal cord injury? And the answer was always, yeah, I bet we could, but we were focused on kids and we had a very limited nonprofit budget. And so when the funding wasn't clear and we weren't going to be able to articulate the design and hire, we couldn't even pay some of our tax. I was filing taxes on the behalf, and some of our QuickBooks is what was even a challenge. When I was looking at that, I thought there's got to be a better way. This is a really important need. It's unmet. It affects a lot of people. And I think we could do something to change this. So I went to the Minnesota Business Cup and I entered with an idea of if we could explore a larger serviceable market that included adults, maybe the kids could benefit too. Because in the past 18 months, I had met with over 20 families that that could be helped by this technology. I met with probably 50 plus physicians and OTs and physical therapists, occupational therapists, to try to deliver a solution. And so I understood some of the current limitations and what needed to happen. And so with the Minnesota Business Cup, I assessed this larger opportunity and found that it was just a huge opportunity and that I could get funding if we looked at this larger market. So after being a semifinalist, I created a business plan and a pitch deck and a 1-minute video. And I was the first group that I pitched, and about Bios Partners out of Fort Worth, Texas. They funded us. And so that was about 3 years ago today, this January. We've had funding for 3 years. And since then, we've been on a mission to study and build a solution to this problem that includes children and adults.
What a story! That's incredible. First of all, I think your experience at Magic Arms was kind of a definitive point in the journey, because it gives you a sense of the market demand, even just children alone, and then of course the friction point, which is around the fact that they desired it, but there wasn't necessarily longevity in terms of use because of user experience issues. We didn't even get into the cost issue, which is another prohibitive aspect. Now, what Abilitech Medical seems like you guys are doing, and by the way, I guess you guys sometimes refer to it as wheelchair for the arm, is that it's this in-home device that provides a functional assistance and support to the shoulder and the elbow, powered by springs and motors, coupled by a soft vest. Tell us about that approach, as well as also the fitting aspect, which is custom calibrated versus custom made, and why this approach is working better for you guys.
Sure. Well, it's important to understand that the Magic Arms technology was fueled by rubber bands. They had, just like in a physical therapy, yellow, green, blue, red rubber bands. And anytime you needed to lift your arms at different levels, you had to put on a different rubber band in color. And likewise, when the patients, they walk through the halls with arthrogryposis multiplex congenita, their arms kind of floated and they felt like a little Frankenstein effect. So that was a clear limitation, their elastomeric potential energy, as well as the TLSO that it was mounted to, which is commonly used for scoliosis patients. It was hard, rigid, restrictive, and hot. And so we knew that we had to fix those two things. So right now, we've designed a device that is wearable, so it addresses that rigidity, that the TLSO, and it is made with breathable materials, so it is not as hot, and it is form-fitting. It provides what we call the proximal stability for distal mobility, a therapist saying. But what happens is if you support the trunk, you have greater use and kind of wingspan and a greater functional envelope with use of your arms. So the vest was a really important addition and iteration to the existing Magic Arms technology. And then we go to the armature. So the other piece is that the alignment to the shoulder and the joint center of rotation is really important, because if it's just off by an inch or two, it impacts the functional range of how much they can move their arms into what location. So we knew we had to get it right. And we've spent quite a bit of time working on the shoulder mechanism. And then the arm. With Magic Arms, we weren't able to adjust for the growth of the patients. And our device does slide the upper humeral portion, slides 1.5 inches to be able to provide for growth of our patients. And then I think one of your questions was the custom fit versus custom calibration, custom fabrication versus custom fit. And we felt like we could build a solution where we could calibrate it once to the lifetime of the patient and not have this continual, we studied the myoelectric technologies that are out there. They're quite finicky. If they're not aligned appropriately, just right, they don't work. If you knock your arm on a table or on the desk or a door frame, or you perspire or get stronger or weaker, they stop working. And so it's really a headache for the patient, but also for the clinicians. And it needed to be custom calibrated all the time, which became a real problem and a barrier to entry. So our technology uses a spring, which is much like power steering for the arms is what we compare it to. So it's very intuitive. There's no cognitive barrier that you think with myoelectric, I have to flex my elbow, I have to extend. Instead, you just move. And it means that we can't help some patients. There's about maybe 20% that will be too weak. We say that our patients need to provide about 5 to 10% of the functional lift. That looks like an exaggerated shoulder shrug, where you lift your elbow off the desk or table, and that's translated to a manual muscle test of a 2 in the shoulder and in the elbow. And so we believe if you have that bare minimal functional ability, we can be able to help people eat, drink, brush their teeth, stay in the workforce longer, and live more independently. The wheelchair for the arms is something that's been coined by many of our patients. And you can live independently if you don't have use of your legs with a wheelchair. But if you don't have use of your arms, you rely on other people to feed yourself and brush your teeth. And believe it or not, across every etiology, everybody wants to, one, eat, and two, scratch an itch. You know, they might have a piece of hair, or God forbid, we live here in Minnesota and it's a mosquito. And one of our MS patients said, I watched it bite me, and I couldn't do anything about it. You know, and that's really a helpless situation where it's really frustrating. And we believe we can help these people with really with big things like eating and drinking, and small things. And obviously, some of the bigger, the social emotional pieces, in helping address the isolation that these people live within, and being able to extend, you know, just to be able to extend a hand or provide a hug to a loved one.
Yeah, as I'm listening, what's becoming very clear is I now understand why you're clearly the right person to lead this organization.
Thank
You're really a very detail-oriented product manager that really understands the complexity of this market, the user needs, and all the obstacles and challenges. And from a design, from a UX perspective, user experience perspective, you really try to minimize these frictions and to create a certain degree of elegance. And sometimes I think as technologists, we sometimes get caught up in lots of technology for the sake of technology, but here you're trying to minimize in the process to create that elegance, that simplicity, as well as that adjustability without having to basically customize. There's a
you.
lot of variables to weigh here, and I think it was a really prudent decision to say that, you know, we can't help everybody, because sometimes as entrepreneurs, it's very easy for us to feel like we need to cover more than 80%.
Big
But
challenge.
focusing on what you can do best, and then keeping it simple, keeping it low cost is terrific. So tell me about kind of the feedback that you're getting from the patients, the users. What are they saying about your product?
Well, first, we bring our device to market in June. So we are preclinical. All of our work, no patients have taken our devices home. Everything's been in the clinic or in our office, where we've learned on limited experiences. And there's an incredible sense of hope and excitement in these patients. You can see it in their eyes. There have been patients that have burst into tears, several in our office, that with the ability to do things that they have lost before. So that idea of the hope and sense is just profound. And likewise, we've had incredible clinical support, unparalleled to anything I ever saw at Medtronic. Medtronic, we might have brought the next better new pacemaker, but we really weren't starting and meeting an unmet need. And so our clinician partners were located here in the land of medical device. Minnesota has an extensive workforce here. So what that means is we have great resources and excellent hospitals. But our clinician partners recognize this is an unmet need and want to help. And so we are 3 blocks from 2 of our Gillette Children's and Health Partners Neuroscience, and great relationships with the university and Courage County, Alina, and blooming interest throughout the state and country to work on this problem that there's not a great solution for. So we've been met with great enthusiasm, and that means that the doctors often give us their cell phone. They'll take a call. Nurses or the OTs, PTs will come by our office after work and provide input. The challenge has been at Medtronic, you could always test a pacemaker in an animal lab or something. And this is not, you need real people, and there's quite a variability across even their week of what they're, how well they slept and how they feel. And then the next year you might see them again, or next couple months, and maybe they're stronger or weaker. And so we make it the goal to be in front of a patient every week and a clinician every week, to stay in front of of the problem that we're solving, and make sure that we always have the patient need is the primary focus.
That's fantastic. I love the fact that you guys are patient centric and making sure that it is not a one-time fitting, but it is something that is part of them, and recognizing that the needs are going to vary, and make sure they can perform through the volatility of their strength as well as the range and everything else. Let's talk real briefly about the fact that you guys are founded and operating in Minnesota, as
Yeah.
well as the fact that you guys are women-led from a co-founder, which is terrific. So talk to us about those two unique aspects.
Women-led is sort of, we all have to meet our milestones and deliver on our objectives. And so while we certainly have certain advantages, there's a clear bias in fundraising. So it's been a little bit more difficult. Many people aren't aware that women get 2.3% of venture capital across the U.S. And that's been a challenge to address. But I've successfully raised $11 million to date, but it's been a lot of hard work. Tell me your second question.
Minnesota.
Minnesota is just a terrific place. We have all the resources we need. We had a great experience in Texas at the Texas Medical Center in Houston. There are amazing clinical partners, but we have, opportunities to expand your business. We have the workforce here. I had to replace an R&D director or VP. I had 7 amazing applicants within 2 weeks without using a search firm. So that means that when we need somebody for a quality or a biomedical engineer or a robotics engineer or electrical or a reimbursement expert, we don't have to look very far. And I've been able to select some of the best and brightest on my team to build with key domain expertise that you just can't find in very many places. And further, because we're in this flyover territory, we do have a lower overhead than the coast. And so it's a prime area where we can get a lot done and be very capital efficient.
Terrific. And my last question is, as you look at your startup and some of the challenges, what was kind of maybe a product or organizational kind of failure where you learn from that and there's a lesson learned that you want to share with others?
Failure is really just learning. And this is something that we've been in continual progress to try to evolve and get better and stronger. And so while we have, by many measures, been very successful and will deliver an excellent product to market, it came from failures in understanding what's a better cable design, how to pull it through, the technical challenges, the longevity challenges, understanding what people and getting that continual feedback that you really need from the patients and the clinicians to understand for the best performance. And likewise, you have to launch sometime. And so the device will, with patient feedback, we will get stronger and better and smaller and even more effective. So we're always improving and are excited to get out and make a difference and restore independence in patients who often live in quite isolation. And we're excited to make that difference. And so we're getting out with a device that is going to make a big difference, and it will continue to be improved throughout the next 2 years.
So with that, I've been joined by Angie Conley, CEO of Abilitech Medical. Thank you for joining today.
Thank you very much.